Testing 1 2, mic check 1 2 3 4. News conference will begin in about 5 minutes or so. This is a mic check 1 2 3 4. Checking 1 2 3 4. Are we okay? Checking 1 2. I've run out of numbers.
Can have a couple of these. Good afternoon, Minnesota. Thank you all for joining us again, and thank you to the press pool that's here. I'll remind everyone that to keep social distancing, our journalists are taking turns being part of the pool, so they're not only asking their own questions, they're asking for others and sharing their work together. Start out today, not great news, 17 fatalities. As you saw, it was announced we've gone over 2,000. I think it's important to note that while this is our single highest day total of both new infections and fatalities, it's one data point in time. We're always, as we've talked about, looking for trends. I don't think it's surprising to anyone at some point in time we will start climbing that curve. The work that all of you are doing in Minnesota is to keep that curve as flat as possible. Obviously keep the peak down, but this is not that unusual, but it certainly doesn't lessen the tragedy, and you have my sympathies to the 17 families today who lost loved ones. We're going to have a few different folks talk today. I'm going to be joined by Dr. John Hick, who is the Deputy Chief Medical Director at Hennepin County EMS, an expert in this. Dr. Hick came to us as a special advisor to our team, has expertise from the 2007 I-35W bridge collapse to other things, have been working on this, and I want to have him talk a little bit about his work he's doing on surge preparedness. And Mary Turner's going to be here to give a firsthand account and a very, I think, poignant view of frontline nurses as the president of the Minnesota Nurses Association. So we'll talk about a little bit of what they're doing, but I want to go over a few things first of where we're at. Jan Malcolm will, of course, bring in her take on where we're at, some of these numbers and what they mean. But I think many of you saw yesterday, Governors Whitmer, DeWine, Evers, Pritzker, Holcomb, Andy Beshear of Kentucky, and myself joined together in a Great Lakes Upper Midwest compact. This is something we've been talking about for several weeks. You saw the states in the Northeast and states on the West Coast do some of this. The purpose of it is the governors have been sharing very extensively best practices, ideas, things that worked and didn't work, and also talked about common borders and an understanding that a virus does not respect a border. It certainly doesn't respect political differences. So I think what's good about this is a bipartisan group of 7 governors, 2 Republicans and 5 Democrats, who've worked together on other issues and coming together. I think it's important to note that while we have a set of principles that we're working on, and I would reiterate what those are because these mesh exactly where the vision of Minnesota was trying to go through this entire process, and I think they also fit very closely with the administration's 3-phase plan that they rolled out yesterday. Sustain and control the rate of infections and hospitalizations is a top priority as you start to move towards trying to reopen an economy. Testing and tracing of contacts to a very high level. Sufficient healthcare capacity, and then best practices on social distancing in the workplace that we're learning. Those will not look the same in every state, and we will not move in lockstep, but we will talk about and share those practices back and forth as we implement them. So I'm excited about this. I think it shows that the sense of protecting Minnesotans, but our responsibility to protect fellow Americans, whether they be in Kentucky, Ohio, Wisconsin, really does matter. And so I'm really proud of this group working together. I think it comes at a time, too, with the president's announcement yesterday that the governors were to lead, that they were to take the lead. I think that is what I've been articulating over the last several weeks, that it became very clear. We take them for their word on that. That's why we are starting to stand up some of these, not just regional coalitions, but the public-private partnerships. Dr. Hicks, Commissioner Alice Roberts-Davids will talk a little bit about. On this day also, Tom, this is for you. Executive Order 2038 was enacted. The question came up, and it was serious as we talked about this for quite some time. Trying to understand the social distancing that we put in place is our number one defense against the spread of this. I've asked you Minnesotans to give us that space to build up hospital space. Dr. Hicks will talk about that. I've asked you to try and help us get the PPE. Alice can talk a little about that. And then I've asked you to figure out ways that we can start to think about these practices that work, that we can extend them further, because I'm very cognizant of this. Life has to be about things that you enjoy doing with family and others and trying to get there. And so Executive Order 2038 expands available and allowable outdoor activities. We know that we can do these things. There's lessons learned over the last several weeks of what we can do. It's asking you to do outdoor things, maintaining 6-foot social distances, avoiding crowded areas, staying close to home. The first paragraph of this, I want to try and be as clear as possible. You can't spell this out to the T that maybe an attorney would want to see, because we're talking about getting society to act differently than we ever have, and to try and implement some things that the medical professionals tell us work, but there's always going to be a gray area. So I guess the thing I hear most of is, don't travel all over the state. Don't travel up north now and crowd rural hospital situations if we would get out there and make the case where they don't have enough beds or ventilators. But get to where you can distance, get to a course nearby you, get out to a lake, get to a park where you can follow those measures. And then we've been pretty specific, and we've worked with the people, and this is going to be true of other businesses, We've worked with the professionals who know how to do this. They'll be disinfecting if you're using a cart. We say single riders is the best, but if there's a family, it's a spouses or siblings, to do that together and then to be smart. Also, I'd like to announce we're going to be launching a homemade mask drive. Crafters, sewers, creative people all over have been doing this. We're going to try and organize a little bit around this with an understanding. These are not N95s. They do not trap 3 microns of this virus. But what they do is when we wear them ourselves, they keep us from getting other people sick, or at least try and control that some. So next Saturday, April 25th, from 10 a.m. to 2 p.m., we're inviting folks to drop those off at their local fire stations. We're going to use that as a way to get them out to folks who need them. So I know this is happening on its own. We're hearing that people could use more of these. I'm encouraging people, many of you in here are doing it, of when we're outside trying to wear our masks. And then I'd like to talk about a few other things we have going on and the disruption that you're feeling. This issue around mental health issues is continuing to come up. We know that people feel isolated. I did a conference call this morning with AARP and for some of our seniors in the organization, of looking at the well-being of seniors, both physical well-being, financial well-being, and mental well-being. And just to know, our mental health providers are open. We have made changes through executive orders to allow telemedicine, and they're taking a lot of calls in. This is working. So we've launched a mental health page on our COVID-19 website to try and make it easier for folks to get there. I would say this: if you or someone that you know is in crisis, text MN to 741-741 at any time, and someone will be in touch to you, or call ** crisis. And those are ways that we have folks on. We're ramping up the capacity. We're connected to the mental health providers. So I want to note on the specific page of MNGov COVID-19, you'll find links to tools and resources our agencies and local governments and non-partners have built. The website includes contact information for NAMI, the National Alliance on Mental Health Minnesota, and Minnesota Association for Children's Mental Health. For essential personnel like healthcare workers and first responders, the Minnesota Psychiatric Society, Minnesota Psychological Association, the Minnesota Black Psychologists, and Mental Health Minnesota have collaborated to create a free telephone support service at fasttrackerminnesota.org, and we'll have these up on our site to make sure that folks in there, real-time substance abuse, whatever it might be, getting in contact. So please reach out. Know you're not alone. Know that we understand that this is challenging. And then I'd like to also note something that we're seeing across the country, and it's coming, certainly it's here too. We know that the examples are hitting communities of color disproportionately, the impacts on public health crisis. We knew that there were social determinants of health that were already disproportionately hitting communities of color. COVID-19 is just exacerbating that. So our indigenous communities, people of color, immigrants, and refugees are more susceptible to this and to die from COVID. The numbers seem to be supporting that. Many folks are the essential workers that are carrying out those daily jobs in our community. They drive the supply trucks, stock the shelves, care for our children, parents, and friends, and through no fault of their own, they're now being faced with the virus. So we want to make sure on this that we're taking care of that. We're highlighting and know this: the unemployment rate of people of color is more than double of white Minnesotans, and this is a statistic none of us wanted to see. The rate of unemployment for black Minnesotans is the highest it's ever been, and that means that exacerbates every other problem that's there. So we formed a community resilience and recovery work group to ensure the needs of individuals and communities that were already experiencing health disparities are part of our solutions. We're going to be talking about policy making, executive actions and executive orders, communications and outreach, and ways to make sure that we're hearing the voices of those communities. So you can find that on our COVID-19 website page, minnesota.gov/COVID-19. And as I've said before, we want to be data-driven. We want to make sure that we're getting all the information to the public. We want to make sure that we're nimble, working with our public and private sector partners. And we want to make sure as best and new information comes up, we act accordingly. And that brings me to somewhat of a developing situation that some of you are starting to see at the JBS pork processing plant in Worthington. I was on the phone with the CEO of JBS, the plant manager, the president, as well as the representatives for the workers in the plant down in Worthington, represented by UFCW 663, and the mayor of Worthington all this morning. We have positive cases showing up in the JBS facility. I think for many of you very familiar with Southwest Minnesota, there's a lot of movement across back and forth from South Dakota. There's also a lot of family members that work in both plants. And so there was a lot of cross work that went there, or cross contamination that started to happen. I think the good news on this is plant management has been monitoring this. They have been in direct communication with us. And I don't know, those of you who followed this closely, the Smithfield plant went from nothing to shut down overnight. There was not communication with the health department the way we understand it. That is not the case here. Management has been in conjunction. You'll hear a little bit from Chris Ersman or Jan on this potentially today, who looked at this. We have spoken, as I said, with all of them. We have put a team down there. The Departments of Health, Agriculture, Labor, Industry are working with the plant and local officials to set up testing, ensure safe conditions across the community. There are about 2,000 workers in this site down in Worthington. It is a foundational piece of economic activity. It's also, again, the cascade of these closing plants on food processing poses a risk to the food supply system. So it's in our best interest, both from an individual health perspective, to keep folks healthy. It's in the best interest of the community to keep it operating, but it's much broader than that. This is part of a national food supply system and a large piece of it. So what I can tell you is the plant is up and running, that they have implemented many changes to the plant in terms of getting out PPE to their workers, putting up shields, and they have indicated to us that the desire to go further. I think, again, we know that one of the ways to get back to normal, and the JBS plant may be a test run for us on this, is widespread testing in these cases is the way to go about this, ways to go about tracing. We know this is a big step. We know that it's hard, but we also know this is the path out of this, to be able to test, to isolate, to do the tracing, to make sure we're isolating everyone who came in contact, and then to move forward. So we're reaching out to other processing plants across this. I would remind Minnesotans that the way we protect each other is to continue our social distancing, to continue to make sure that we are doing the things necessary to protect those that are most frontline. And while they may be food processors, we know the folks that are put at the most risk of this, the elderly, the most vulnerable, but those who care for them. So our next two speakers are going to come after Jan, are going to elaborate a little bit on this in terms of what this actually means and what our social distancing buying. But before we bring up Dr. Hick and Mary, let's turn to Jan Malcolm for a little update on where we're at.
Thank you, Governor. Good afternoon, everyone. Well, I have today's situation update from around the world and here in Minnesota. Globally, as of this morning, we were at nearly 2.2 million people infected with COVID-19 and unfortunately 146,000 deaths. Again, this is a rather breathtaking speed of spread across our entire globe with this novel virus. In the United States this morning, we were approaching 672,000 cases and nearly 31,000 deaths. Here in Minnesota, as the governor has mentioned, we have passed 2,000 cases, 2,071 laboratory-confirmed cases, up 160 from yesterday. As Governor Walz indicated, that's our largest daily increase so far from laboratory-confirmed cases, and very sadly, 17 additional fatalities, as the governor said, reaching now a total of 111 so far in Minnesota. 9 of these were in Hennepin County, 2 in Winona County, 1 each in Dakota, St. Louis, Clay, Nicollet, Anoka, and Rice. So you can see the increasing spread across Minnesota. Most of these individuals have been following the same pattern, many in their 90s, 80s, 70s, 2 individuals in their 60s in this case. As of today, 1,066 patients have been released from isolation. So that's the good news. There are currently 222 patients in the hospital. 106 of them are in intensive care. And Dr. Hick is going to talk about how very important it is that we understand and support the healthcare capacity across our state so that we can take good care of the people who develop this illness. I do want to mention just a couple more things about the Worthington situation that the governor just mentioned. We've been very closely following the developments at the JBS pork processing facility, and there has been a significant jump in cases just in the last day or so. We discovered yesterday, just with the number of cases, reports coming in, confirmed tests coming in from the Worthington area. As we began those interviews, it quickly became clear that there was an association with the JBS plant. As of right now, our understanding is that there are at least 30 confirmed cases in the Worthington area. 7 of them so far have been determined to be associated with JBS, but we expect that number to increase as the interviews continue. Chris Erzman is here with us if you should have more detailed questions about that investigation down there. Chris can answer those. But we know from all of our experience with this epidemic so far, congregate settings are key. Whether it's congregate living settings like nursing homes, congregate care settings like inpatient facilities of any kind, and long-term care facilities in particular, where we know there's a concentration of risk, corrections facilities, homeless shelters, and now congregate work settings, where there is close proximity, there is a risk of disease transmission. So right now in Worthington, we really are, as the governor said, already mounting a very well-integrated response. Local public health's involved, local emergency management. The plant managers are cooperating with us. The whole local community is involved because, as the governor said, this is not only an anchor of the community economically, but we know that there is spread in the community now, and so this needs to be a community response. We're very grateful for our local public health partners and the healthcare system down there that's very well on top of this situation with us. And exactly what the governor has described as a regimen of identifying those who are ill through symptom identification, through testing, and then through isolating their close contacts and testing them as well. So that's exactly what we're doing to make sure that we can separate the ill from the not ill as quickly as possible and to keep them and their families safe. And it really is a goal of ours to help this plant continue to be able to operate safely. We would love to avoid the situation where the only choice is widespread contamination and closure of a plant. So the quicker we can get on these things, the more effectively we can mount a public health response to this, the more we hope that we can serve both aims of keeping the community working and keeping people safe. I'm really glad that Governor Walz told you a little bit about Dr. Hick's background. John Hick is a special advisor to the health department in this event. We're grateful to Hennepin County Healthcare, Hennepin Healthcare System for loaning John to us. He has a unique resource. He is nationally known as an expert in that intersection of clinical care and emergency management. And John, being part of our incident command structure, working here in the SEOC, he's helping coordinate all the planning around healthcare capacity, but most importantly to me, he's bringing the patient care voice to every single decision. Everything we do is informed by how it's going to affect patient care. So it's my really great pleasure to introduce Dr. Hick and thank him for joining us.
Thanks, John. Thank you. Thank you, Commissioner, and thank you, Governor, for giving me a few minutes to speak this afternoon about our healthcare preparedness for COVID-19. This is a historic epidemic, and we are making historic preparations for this. I just want to shout out to our caregivers that are providing care, whether it's in home care, long-term care, hospice, palliative care, clinic-based care, hospital care. All of you are on the front lines. All of you are putting yourselves at risk day in and day out to make sure that our patients continue to get the care they need. And we want to, as a system, using all of the private sector and public sector response, try to support you and protect you as best we can. So thank you for all that you are doing. I am manager right now for the State Healthcare Coordination Center. That is a public-private partnership between Minnesota Hospital Association, our state agencies, the Minnesota Department of Health, and Homeland Security and Emergency Management in particular, working with our regional healthcare coalitions to try to make sure that we're leveraging our regional preparedness, our hospital association and our partner preparedness, and all of government to bring the right strategies and the right resources to bear as we prepare and see COVID-19 cases continue to rise in our communities and continue to occupy more and more hospital beds in our hospitals. We're grateful for the time that Governor Walz has bought with the stay-in-home orders that have allowed us to manage that flow of patients into our healthcare systems to steady but not a surge of patients. And we hope that that will continue as we continue to ramp up our testing, better understand our treatment options for these patients, and better prepare to accommodate what could be a very large volume of patients later this summer. The State Healthcare Coordination Center is blessed to work with each of the 8 regions of the state who have existing healthcare coalitions. That's our emergency medical services, our hospitals, our emergency managers, and our public health providers working together to make sure that each region of the state has been prepared since 2002 for a variety of hazards and a variety of situations, including pandemics. And unfortunately, we're having the opportunity to test those systems now. I just want to give you a little bit of perspective on some of the things that we're doing as part of that. One of the intents is to make sure that we have a consistent level of care provided to all residents in Minnesota, that we leverage all of our hospital beds, whether that is in Worthington or Wayzata, wherever that is, and we're providing the care that's the same between Richfield and Rochester. We want to make sure that hospital patients are in a hospital bed whenever possible. We also want to make sure that long-term care residents, where we're seeing a tremendous explosion of cases right now, are provided with the level of care that they need in a safe environment that protects not only them but the other residents of that facility. So to that degree, we have a hotline being launched next week to help coordinate hospital discharges to long-term care facilities and also manage any transfers between long-term care facilities that might be necessary. That hotline will continue to provide services as the incident continues to grow by helping outstate providers access intensive care unit beds and find beds for transfer so we can keep as many hospitalized patients in the hospital and avoid situations, as you may have seen, with large congregate facilities like the Javits Center in New York City. We are planning for such community-based alternate care sites if they are needed, but we are also asking the healthcare systems, and they have stepped up remarkably, to prepare on their hospital campuses additional areas, even outside of their usual patient care areas, for patient care. So we are feeling more optimistic that we will not need to rely on some of the community strategies that have been needed in other areas in order to provide overflow hospital care. We are very blessed. When we think about our critical care resources here, we operate routinely about 1,300 ICU beds in the state, and we're prepared to more than double that. We also have about 2,282 ventilators between our usual ventilators, anesthesia machines, transport ventilators, and other resources. That puts us second of all the regions of the United States in our upper Midwest in terms of surge capacity for our intensive care resources. And as you watch events unfold in China and in Italy, please remember that in the United States, we have 3 times the intensive care unit capacity that Italy does. We have 10 times the capacity that China does. And we are working aggressively to source other respiratory protection equipment like ventilators, like high-flow nasal cannulas, and other materials that can help support patients when they get very, very sick. I also want to mention that we're working hard to augment staff in these facilities. That with the long-term care facilities, we're trying to help them find additional staff to cope with the overwhelming number of cases that they have in some of their residences right now. We're also making sure the healthcare system is prepared to strategize and use staff in ways that they might not normally be used to extend our ability to provide that critical care to all the patients that may need it. From a supply standpoint, we continue to operate in a scarcity situation when it comes to the right personal protective equipment, the right types of masks and things to protect our providers. That's unfortunate, but thanks to the tremendous efforts of Commissioner Roberts-Evans and others, we have now found and sourced some better options for masks as well as other materials, and we're bringing those into Minnesota as rapidly as possible so we can get the best protection available to our providers as soon as we can and in time for hopefully large surges in the number of COVID patients coming into the hospitals. So in short, we've bought time, and we have, in an unprecedented way, as healthcare systems, as individual providers, as a state, come together in a way to support building out a plan for accommodating a surge of COVID-19 patients into our system that is unprecedented. We need to continue to learn more about this virus. This virus is terrible. This virus kills both discriminately in our populations of color and our aged population, as well as indiscriminately, picking off young, otherwise healthy individuals in ways that we are still understanding how that happens and trying to find the right medications in order to provide the best treatment that we can, and know that the Minnesota institutions are on the cutting edge of those research efforts and are engaged in many, many research trials right now to find some of the best treatments possible for COVID-19. So with the time that Governor Walz has provided for us with the stay-at-home orders, we have tried to make the most of that. I also want to caution that some of you may be staying at home too much. With the declines in our emergency department volumes that we're seeing, we're very concerned that people may be too fearful of COVID-19 to come to the emergency room when they're having chest pain, to come in when they're concerned they might be having a stroke or having other symptoms. Please understand that the emergency care system is there for you all the time, before COVID and during COVID and after COVID, and use it when you need to assure that your health is protected. And we will do the best we can to help you get good medical care throughout. But for now, please stay home, stay safe, and thank you.
Thank you, John. We're going to be joined now by Mary Turner, leading up our nurses. Thanks, Mary, for all your work.
Hi. Thank you. My name is Mary Turner. I am president of the Minnesota Nurses Association, but more importantly, I'm a medical intensive care nurse at North Memorial in Robbinsdale. And I work on that hospital's first COVID-19 ICU floor. First of all, I would like to thank you, the people of Minnesota, for acting as one and coming together to do what we need to do with the social distancing. If you hadn't, our hospitals would have been overrun with COVID patients, and we wouldn't have been ready, we wouldn't have had enough beds, we wouldn't have had enough equipment, and we wouldn't have nearly enough PPE. So I want to thank you, the people, for giving us every day, every hour, and every minute to help us prepare. I can't thank you enough. But I do want to stress to you that we are doing a fantastic job of getting prepared. But you also need to know just how real this is. I'm living the dream. We have a full floor of patients that are on ventilators. And they're on these ventilators for several weeks. Just when we think that they're going to get better and we take their tube out, we have to put it back in. This terrible, vicious virus attacks not only the respiratory, but it attacks the heart, and it's attacking the kidneys. It's spreading throughout their whole body. And I don't know how many calls I've had during the middle of the night. Family begging to see their family members, asking us can you just please put the phone up to their ear so we can tell them we love them. Because if you become a patient or your family ends up in the ICU, you can't see them. They can't come to hold your hand. And as family members, you can only call to the nurse station to hopefully get a more positive update. So I want you all to realize just how real and devastating this will be. And I get it that we want to economically get back to business, but this is serious, and the way we're doing it and the way the governor is leading us with his intelligence and his strength and his just awesome leadership is going to help us get through this. And I just want once again to thank you, the people of Minnesota, for doing the right thing and doing it so well. Thank you.
Thank you, Mary. Thank you, Mary. Thanks, John. To put a little perspective on what we're doing, before I take questions, I think Mary's exactly right. The work that Minnesotans have done have put us in a place unlike any other place in the country. The ingenuity of people at our healthcare institutions, the University of Minnesota, Mayo, and others have put us in a place to be able to test at a level unlike anyone else. But I also do worry that as we're watching other people cross the peak and we're seeing us be under anywhere else, that a false sense of security might start to creep in. Again, I want to caution about reading too much into today's number alone. But I also, as I said, during my State of the State and before that, we're going to do everything we can to save people, and these folks on the front line are doing it, but unfortunately we're going to see this thing start to ramp up. Our goal has to be to protect as many as we can. With that, any questions from the folks here?
Governor, on Tuesday in the Senate and today in the House, in fact, they may still be talking in the House about this issue. They keep talking about the difference between scenario 3 in your modeling and the subsets and scenario 4.
Yeah.
And their claim is that the outcomes are the same, the peaks are somewhat different, but the ramp down on activity is different. And they go, Governor, why aren't you using scenario 3?
Yeah, they're not wrong, and the reason I'm not using scenario 3 is scenario 3 is predicated on two things: ample amounts of PPE and surge capacity and testing to get there, because scenario 3 gets us to the point where we have set up from the beginning we want to get to. We're able to test, trace, isolate, and bring as much things back on as we possibly can. So our point was, and when you see that, again, it's modeling, so it's a snapshot in time. It shows a trend. We do believe that scenario 3 is the place we need to go. When we started opening and thinking about how do we source the PPE, how do we ramp up the testing to get there, that was one of our thinking. At the time that was put out there and the time that we extended the stay-at-home order, we did not have that. And as Mary said, it was to create that time. My goal is that I think the only sustainable place is looking like scenario 3 in that modeling. And for folks out there who aren't familiar with that, and it's one point in time of all the things we need to do, I've said from the very beginning of this, sheltering in place till a vaccine comes is not sustainable. We had to figure out a way to first understand, and we've learned so much in the last month about this disease, about this virus, is to be able to first and foremost identify who has it, to isolate, trace, to get them and the most vulnerable protected. And as you're seeing from Commissioner Malcolm, talks about the long-term care facilities, come up with new ideas, new ways of doing that, and then start to move people back into the workplace, which we've been able to do. That argument about essential workplaces that have figured out how to social distance and not get people sick should apply to non-essential businesses is exactly right. If we have that surge capacity, which thanks to Dr. Hicks, his team, Jan, and everybody else, we think we're getting very close to that. So I think their argument and their message, spot on. The difference was being able to get there. And again, I would remind you of this. People who say, again, and the folks on the front line would tell you this, if we just said, let's go back to the way we were in January and operating, we would kill lots of people, especially those on the front line. And the business leaders, I would go on this, are telling us this. People are only going to go back to places when they feel it's safe to go back to places. Tom.
Governor, President Trump tweeted 2 words today in one of his tweets: liberate Minnesota. And there are hundreds of people, I think, right now in front of the governor's residence with that same message. What is your message back to the president and those protesters outside your house?
Well, I tried to deliver it myself. I tried calling the last couple hours to the president and the vice president. I got no return. My first responsibility is the protection of Minnesota's people. I think we did see yesterday the governor or the president unveiled 3-step plan that mirrors exactly what we're trying to do. He also said governors would be at the forefront. And I just don't have time to try and figure out why something like that would happen. I just have to lead from Minnesota's perspective, is what we've been doing. If they're not going to do it, we'll do it. And I've been saying that. And I don't even mean that critically. That's just simply a fact. But I want to be very clear. If they're protesting staying home, they're protesting Mary too. They're protesting our frontline health folks who need to be there. I will fight to the death to protect those protesters' rights to protest me every single day that they need to. But I think if the idea, I'm not going to read in what something is supposed to mean, other than I don't know. When I called to ask, what are we doing differently about moving towards getting as many people back into the workforce without compromising the health of Minnesotans or the providers? And that will probably take longer than a 2-word tweet, but I think there's a responsibility to tell us that. I'd like to know what they think we could have done differently, because again, we're leading as we were asked. We flattened the curve. We've built up our PPE. We've kept Minnesotans alive, and we're moving people back into the workforce in a safe manner. I would argue we're doing everything that they're telling us to do, but the difference is I actually have to do it here. We actually have to do it here and deliver it. So that's the best answer I can give you.
Are you concerned the president is just fanning the flames among people who are already very, very frustrated?
Yeah, I'm not, again, I'm frustrated too. Like I said, I want this to be over as much as anybody. Again, if I thought we could go back to work tomorrow, that's exactly what we would do. We're using best practices. We're thinking about this. We're having a very deliberate and strategic plan about reopening, not compromising folks. I'm not sure to what purpose that means. So I do worry a little bit about that. I worry that, again, if you're going to protest, social distance. If I don't think there's a debate that social distancing is the best thing we can do. I think most of us recognize, even when many things are open back up again, at least till we get a vaccine, we're going to be social distancing anyway. I mean, that's just going to be the way things are. So, yeah, I hope it doesn't do that. I will never, ever stop dissent in terms of being able to speak your opinion. But I also think when you're advocating for really reckless behavior, that's a different thing.
Governor, the president yesterday addressed the issue of reopening businesses across the country and said he hopes states can start entering into those phases one at a time. Does Minnesota have what it needs to enter phase one, and what is that going to look like?
Yeah, and I'm a little, I think on this, I find it a little interesting on that. Yes, the answer is yes, that we're starting to get that, and that was us building out our plan. It's one of the reasons we were really thoughtful about what it takes to open outdoor activities. What does it take to open different businesses? We are crafting that plan together with businesses, with the Commissioner of Health, with the Commissioner of Labor, putting those standards in place. We're asking businesses to come up and show what their plan is, share it with their employees, and do these best practices. That's exactly what was asked of us, and we think we can. We think we can move significant folks. Again, never overstepping it and putting at risk, being careful that as a spike comes, making sure we're getting that right. But I really do. That's what they asked of us. We have been working on this. We actually have a plan in paper. We have moved things in, and I think it's somewhat interesting that we are continuous on that stay-at-home order, modifying it hour by hour, day by day. And the goal is, again, this is going to be a light switch where everything comes back on. It's turning up that switch. So, yeah, I think we're moving in the right direction. I think their plan to phased approach in is right. I'm not quite certain where. I think we all have to get used to this. I don't think in the short run we're going to see Target Field filled with people. Are we going to see retail businesses being open up to sell? Yeah, I think so. That we'll get there. But it's going to be those large gatherings are going to take a while.
Governor, I have a question, I think, for Commissioner Malcolm. When will we start seeing some estimate or count of non-tested deaths that are presumed either by medical personnel to be COVID-related, either in your overall total or somehow reported separately? But when will we start seeing that?
I'm going to invite Chris Ersman to join me just to see if she has any different perspective on that. I mean, one of the ways that we're trying to do it, we've talked about our broader surveillance, syndromic surveillance system, where we're looking at other influenza-like illnesses to see what those trends are. When you talk about death statistics, we look at our vital records. We look at, and we've been tried to be very clear about the fact that we don't change death records, but are we interested in looking at death records from pneumonias and the like? Yes, we are. But Chris, can you amplify that?
Yeah, we're working with our Office of Vital Records, and so we'll be gathering information on deaths where the individual who certifies the death has indicated that it could be COVID related. But they are also verifying that and making sure that is exactly what that individual wanted. So I expect in the next few weeks we should start to get more information about that.
Good.
I was wondering if Dr. Hick and maybe Mary could respond to this. What is it like in the hospitals right now, HCMC and North Memorial? Could one of you go to the podium and answer that? We've seen the images on the East Coast, hospitals overrun. We hear different story here that so far it's been managed pretty well, and there is excess capacity. Can you address that?
So at North Memorial, we have 4 ICUs, and they're about anywhere from 13 to 16 beds apiece. A couple weeks ago, we were the first one, of course. We were getting them one at a time, and now our floor is full. And it's staying full, because as we move people out, and we are moving people out, people are getting better. There's more to take those beds. Now we've moved down to the second ICU that's going to be, and that is quickly filling up. Our census is slowly, every couple days, going up 10 more people. And I really have this gut feeling that it's going to all of a sudden start to snowball. Part of it is we are worrying at the front lines, our ED, et cetera, about the people who aren't coming into the hospital. So we're little by little, because these people stay on these ventilators for so long. I mean, I worked 3-4 weeks ago, and I came back this last weekend, and the same people were there. That's how long they're staying on the ventilator. And so so they're blocking up the ICUs for such a long period of time. So it's going to start snowballing faster and faster. Dr. Hicks can for sure correct me if I'm wrong, but just from looking at it, it's going to snowball. And they're all going to be full. And you want to know the atmosphere on the floor. You can just picture all the walls. We've got our little bags hanging on little hooks on every wall space. And in those bags has got our individual PPE that we are using. We are rationing, we're being careful with it until we can get an endless supply, right? We're working on that, right? And then, and everyone the doors are closed to the unit, the phones are shut off, I mean, in the sense of we can't get visitors. We're constantly in full garb. It's very eerie. It's very quiet, it's very somber, and it's very scary.
I'm sure you're familiar with the various models. Some show we're going to hit a peak in late April. The state model shows not till June or July. Do you believe that is what the scenario was going to be here in Minnesota? That the worst is yet to come much later?
That
Dr.
would be
Hick?
a Dr. Hick one.
So models are models, and unfortunately they give us a picture of what reality might be like, but they don't tell us what reality will be like. And I think we need to take each model and learn what we can from it, but very clearly there are models out there, such as University of Washington models, that forecast that we're almost in the clear, after the next few weeks. I think, those models have been proved to be a little optimistic, and in fact, they're revising those as we speak because the peaks are lasting longer and are not as predicted. I think some of the models are probably on the more aggressive end, but right now, working with the University of Minnesota researchers, we think that those scenarios certainly are very consistent with other modeling scenarios that we've seen, with a peak in, basically into midsummer, and a peak that could really stress the healthcare system. As was mentioned, this has gone from being a novelty in our hospitals to being a commonplace thing. And we're probably going to see over the course of the summer that it becomes more of an overwhelming thing. The main thing we want to do is make sure that we're not running out of the key intensive care unit resources that we need to meet the needs of those patients. And that's the main goal, is to make sure that that gap is addressed ahead of time.
Thanks, John.
I would just like to amplify on something Dr. Hick just said, because I think that's something we've been trying to talk about with the model, and I think the governor said this multiple times. The model is not to predict what's going to happen on a certain date. It is to illustrate what could happen so that we can take action to mitigate the factors that produce that scenario. So that's exactly why we're trying to buy time and working specifically on things like ICU capacity and ventilators and PPE, because we know those are the variables, the model shows us, that produce the bad outcomes. So the greatest value of the model, I think, in our minds is not because of what it predicts, but what it suggests that we can intervene in to try to change that outcome. So I appreciate, John, you kind of explaining it that way. It gives us a chance to.
I ask that question, Tom, every day of them, and I think the thing that's kind of a real double-edged sword is that sense of pent-up wanting this to be over, watching how good Minnesotans have done, and then the belief it's kind of like we win and this thing goes away and gives up. It doesn't work that way, and we don't yet know, is it going to be year-round? Is it going to have this cyclical piece to it? And I think what's very frustrating is we have done a really good job, we as Minnesotans, as Mary was talking about, but I really worry right at the time where this is getting really hard is where we're starting to maybe move towards a peak. And so that's going to be the part that we have to balance. We have to figure out, and again, I cannot allow the Mary Turners of the world to be overrun in there, because the catastrophic piece of this is the PPE shortage is one thing, The shortage of the actual providers is the one that really keeps me up right now. So that's why I have to keep them as safe as possibly can be.
Can we get some additional detail about the Worthington plant? How many cases are suspected, reported, and what protocols they're taking to test workers
Jen,
at
why
this
don't you
point?
explain
Yeah, I'm going to ask Chris to come up because Chris is leading that investigation as she does all of our infectious disease outbreaks. But I think it is exactly illustrating what the governor has said is the whole point. Identify who's sick, do all the disease investigations, identify their contacts, isolate those people. But Chris can tell you more about the specifics in Worthington.
Thank you. So as of yesterday, we had 19 cases in Nobles County, and as the commissioner indicated, today we're over 30 cases. And as we were doing interviews with the new cases yesterday, we identified that a number of these individuals were employees at the JBS plant. We're working with the plant. We have 4 staff that have gone down to be on site down in Worthington. They are going to be working both with the plant management to make recommendations on how they can best do their operations. The plant has been screening individuals when they're coming to work, but we'll just be working with them on that a bit more to make sure that everything is going well with the screening. We had a call today at 11 with the local public health, with their emergency management and with healthcare from that area. They are exceptionally well prepared. I was delighted on the call. We talked about things like how can we ensure that people can get tested? We brought swabs down because that was a supply that they needed, but the healthcare in the area, and particularly Sanford, has said that they've got drive-through clinics planned that people can be tested. They have a good relationship with the plant, and many individuals have insurance, but even those that don't, they will continue to test. We know that their testing capacity in the lab that they use in South Dakota can test 300 tests a day, but we've also indicated that our public health lab is able to support them. One of the things that we talked about was, as we've said, it's important that we identify cases, and then once they're identified, obviously these individuals need to be isolated, but many of the workers are living in situations where there's probably more people living in a household than could easily isolate, and so public health is working to identify housing options so that people can safely isolate and quarantine. So the community is really working together, and I think we have a great plan for moving forward. So I was very pleased about what we were able to accomplish today so shortly after having identified these cases.
Governor, I'm not sure who wants to take this. This is from NPR. We have 2 major institutions, the U of M and Mayo Clinic, who have said for days that together they can test 40,000 people a day. What's the holdup? What needs to happen to test that widely? And will you ask for and wait for the legislature to supply money for it before they can act?
Yeah, it's a good question. Well, I'm excited about this development. I knew this was possible. We pushed hard. I think it was just 2 days ago where people said, what makes you think that we can get to that number? We're declining. This is developing that rapidly. And so I spoke yesterday with legislative leaders. I spoke with Senator Gazelka this morning talking about ways that we can partner. We are very much aligned on this idea of trying to get the testing done. We believe, and I think Jan's working on this in her team. I don't want to speak out of turn. This is on the testing issue, just to be clear. I know with this team being here, I'm getting out over my skis on some of these because I really feel this sense of urgency. I think for the people of Minnesota to know that there are robust discussions happen, that it is not a decision is made and there aren't ideas going back and forth. This is one where there's a lot of discussion around. Our partners have stepped up on this. I don't think it's a matter of what's happening or what's not happening. I think putting the pieces in place and aligning them and being ready to go. When I spoke earlier this week, it was my goal to make sure that we're testing everybody who should be tested, who needs a test. Now, if that's a hard number, I think that's hard to tell exactly what it'll be. I think with their capacity that they got there, Minnesota is the example of what we can do. And again, I'm not going to put these folks on the spot, but I think the Worthington situation as it develops may be a place to test that theory to try and see. But again, the tracers, the epidemiologists will speak. But there isn't really a holdup. There isn't a disagreement on the money. We believe that we would have the authority once they come up with a plan. Chris is still, and I would say Jan is negotiating with folks because we need to negotiate in good faith for the state to get this deal in place. We think the COVID-19 fund that the legislature gave us would be the place to start with this, but I think there's a desire for the legislature to be deeply involved. They spoke about this too.
Governor, I'm going to put you through a quick lightning round to help empty out my email box and my Twitter feed. A lot of Minnesotans are asking, when are you going to make a decision on the school year? Texas and Wisconsin have decided they're not going to reopen. A lot of people are grateful about the outdoor activities, but they're wondering why not campgrounds? When can youth baseball start? Those types of things. And what about hair salons? A lot of people wondering when are they going to be able to cut or color their hair?
I know people told me that looking at me, they said that's why I'm not concerned about that. I am concerned about the people who cut hair and do things. I think it's a systematic approach, Tom, and I think what you've seen out of us is that I've chosen not to go too long. I think you need to give people an end and see that we're reevaluating and we're changing things. I think you can probably expect that decision on schools, obviously, before or near May 4th. At that point in time, does it make sense to bring them back? These other activities, again, you're right, like youth sports and things, it's just that you've got people in close contact with one another, they're touching the same thing, it becomes a little more complicated. And so we'll evaluate, we'll look at them, continue to talk about it.
Just a quick follow-up. The folks at Valley Fair, Canterbury Park have wondered when are they going to be able to reopen. There's some key decisions made by the horse owners soon about whether to stay here or move their horses elsewhere.
Yeah, well, and I think the thing with simulcasts or whatever to take a look at this, I believe that some of this has actually been happening in some places. I don't envision, at least in the short run, you're going to have the stadium seats at Canterbury full. Would it be possible to keep social distancing, to have the trainers, the work, and the jockeys be able to run? That's something we certainly will look at. And I want to make note of these leisure outdoor activities, they are important to people, but we also have to be really, really careful about they're the things that tend to attract large amounts of people to tight gatherings.
Final lightning round question. Will you sign the takeout liquor
Absolutely.
and wine bill as soon as it gets to you?
Yeah, as soon as it does, and I'm glad it worked this way. And once again, it was good for me to see when I had legislators who are not supportive of my executive authority, but were asking me to do an executive order on the wine and beer. It works best if we work in collaboration. Craft the bill. I already saw that some people said, why not mix drinks on that? That's the legislative process. They work together and reach a compromise. I'll sign it when it gets to me immediately, whatever it helps to help those folks.
I'm wondering, do we have a sense of how many hospitalizations are in the Twin Cities metro versus greater Minnesota? And perhaps ICU counts at this point too, do we know that?
Can we disaggregate that, or do we have it now?
Absolutely.
I think Jan gave those numbers, so we can break those out.
Yeah, we have not been in the practice of identifying specific patients in specific hospitals for obvious reasons, but we certainly do, and I think on the governor's website we show some regional graphics of supply, and we're in at this point we're green, I think, everywhere except perhaps one small part of the state, just in terms of do we have enough capacity today for the expected volume that we see coming. And as everyone has said, we're not happy about anybody being sick, obviously, and are very sorry for the loss of life, goes without saying, but we do believe that we're on the front end of this thing, and unfortunately it is going to grow. I mean, we've been actually pretty pleased with how measured the growth has been heretofore. That as Dr. Hick has said, we clearly have bought some time to prepare, and if we can keep it from being a tidal wave all at once, that's obviously best. John, do you have anything else on specific hospitals?
Not on specific hospitals, but just a comment that the vast majority of intensive care occurs in the large population centers where the tertiary referral centers are. So just because certain ICU patients might be hospitalized in the metro doesn't mean that those cases didn't originate in Fergus Falls or didn't originate in other places and were transferred into a referral center. So a lot of our planning really revolves around our major health system centers in Duluth and St. Cloud and Fargo and Sioux Falls and the metro area and Rochester.
Governor, does somebody else want to answer that? Again, from Brian at NPR, if this has to do with thinking about coordinating as you relax your orders. and he asks, if the stay-at-home order lapses on or around May 4th for many workers or some workers, many parents will have to choose between work and being home with their kids if school is still out. Will schools reopen on a similar schedule as workplaces? And conversely, what happens if parents are uneasy about sending their kids back to school and decide not to?
Yeah, well, these are the complexities, and there's the secondary and the tertiary impacts of decisions we're making, and so we are taking that into consideration. I do think you have to keep them in alignment. It's one of the reasons why we kind of, just for date purposes, aligned everything, and of course it was before the administration did their May 1st, but aligning everything on May 4th. But yeah, those are concerns. And again, that's a good point, Peter, about this is going to really involve trust. And that's why trust in that people, again, you can open up your business, but if people think they're going to get COVID going there, they're not going to shop whether it's open by an executive order or not. And I think the same thing is true of schools. And there's a lot of debate still around the idea of schools and what you gained by that, what you did with parents, being able to, the children not bring it home to parents and grandparents. But there's a lot of research that's still evolving. So I have still, just to be very candid, I think we have not made a decision. As I've said earlier, I think it's unlikely that we will come back. But I'm also seeing things that are developing very, very quickly. I mean, I don't think you don't spread the false hope, but the Gilead work and some of the things that they're doing, all those things could start to develop. And if they should, and if should therapeutics come up, that changes our whole site picture. So I think, just to keep people in mind, we understand that the uncertainty causes more stress in this situation. We try and get you out the information as quickly as we can, but that's still ever evolving.
Governor, the governor of Wisconsin extended his stay-at-home order to May 26th. What's the likelihood, I know it's early up before your May 4th deadline now, that you would also extend yours? And along with that, a state senator stood up on the Senate floor yesterday. He's also a doctor at HCMC, and said he doesn't even think the legislature should be meeting because he thinks it violates the spirit of your law right now. And even though he's been in contact with COVID-19 patients, he was on the Senate floor yesterday. Your thoughts about those two issues?
Yeah, this gets tough, and I'm very protective of the independence of the legislature, just in that regards, of them meeting and how they do it. And I'm watching and in contact with some of my colleagues in the United States Congress about how they're thinking about doing distance on this. It's very that's very challenging. As far as the executive order going on, it's going to be dependent on where we go. It's going to depend on what the peak looks like, as you've heard. I think it's unlikely that it would look the same, just like this one didn't look the same as the other, because I think we are making movement. And again, I want to just ask Minnesotans, by doing this, the only way this is going to work, even with something like golf or shooting ranges or trails, is if we follow those washing our hands, stay home if you're sick, cough into your sleeve, wear a mask. If we don't do those things, there's nothing we can do. And the fact is, if you have a hunch that it would be better we opened up, the virus doesn't care about our hunches. It doesn't care about where things are at. What it is going to do is infect people. So I think at this time, I guess, we're hitting a really critical time, Tom. And this is something that I'm keep dwelling on. We've done so well, and it might be a double-edged sword for us, that I'm just afraid people are ready to bust out, and then this thing spikes up, and of course that changes our calculus. If we can keep a maintainable sense of social distancing and getting people back in the workforce, we'll come out a lot better. I don't know yet at this point.
Follow-up. Would it be a phased reopening, like you wouldn't initially allow health clubs and movie theaters and those types of things? Would it be more of a gradual reopening?
And that's the way the president's plan put out. Like I said, I haven't analyzed it all, but it looks pretty good of what they're talking about. Turn the dial back up, bring things back in. I think the most unfortunate thing is the things we probably want more than anything: big sporting events, crowded bars and restaurants, large backyard parties are going to be some of the last things that come back on. And so that doesn't mean, though, we're back. And I think we're probably going to be shopping for groceries, social distance with masks on, for quite some time. But you can go out and do it. There will be more things open. Hopefully a significant number of people are working that were not critical jobs anymore. They're social distancing at work. They're coming home. They're going to play a round of golf, twosome, with a disinfected cart, that's all going to be different, but it's more back towards that. Again, I just don't see the sports stadiums being filled immediately, and I think it's going to be hard prior to a vaccine or some type of very effective therapeutic. But we'll roll them out slowly.
One more question today.
Governor, we've heard you say you'd like to see more testing at food processing plants.
Yeah.
Can you speak to what's in place now at most plants and if that's...
Yeah, Jan, you might have a better, do you have an idea? I mean, that's hard
Yeah.
because of, well, you know.
We're not aware of any plants that are kind of proactively doing testing. More and more of them are doing health screenings, and we appreciate that. The fact that employers are asking their employees when they come to work at the door, doing that, that menu of health checks, some of them using temperature screening, the JBS, and I think other processors around the state have begun to really incorporate some of those screening measures. The idea of when to do the kind of testing that the governor has talked about, the serology testing that can begin to identify if someone's been exposed in the past and therefore might be have some built-in immunity. That's a promising area of work, but a lot of research still to be done on how much immunity an illness produces and when somebody's really safe. But that's the kind of testing. I think there's as we've said over and over, the diagnostic testing, which is what we're doing right now with JBS, and then in the future, the kind of screening testing that might be more useful for bringing people back to work. But that's what we're working on now.
And Dana, what I would say, I guess it's my vision, because I'm hearing stories when I'm asking them about this. They're doing the best they can down there, so somebody came in, tested with a fever, didn't say they didn't feel bad. They sent them home for a couple days, and the company extended their benefits so that they could go home with some paid leave and all these things that make a difference so people don't feel like they have to drag themselves there or they're going to get kicked out. But when the person felt better, they came back. And the reason is that we don't have the capacity or didn't have the capacity to test that person. That would have been the perfect time to test that person. They come through that line, they test with a fever, test them, get an instant ID on that, because what we know about this now is more than likely that person very well could have had it and been mostly asymptomatic. And so my vision is, and again, I want to be very careful, and just so all of you know, these are robust discussions, and they're robust discussions globally about the value of testing. I think the preponderance of folks believe that more testing, the number of people who need to get tested, makes a difference, both on the molecular front end, are you sick now, and the serology, have you been sick? They agree with that, but we have to strike that balance. I do believe, though, these critical industries, and I just have to say Minnesota's responsibility to feed the world, we can't have all these plants go down, not just for our workers in our local community. We have to help feed the world, because I'm telling you, this thing gets really ugly if we got to send people back sick. We have to, see the shortages in the grocery stores. So, just so everyone out there, Minnesota's moving on this. We believe the regional partnership is the way to go. We agree with the administration's phased approach of bringing things back online. We are grateful that the administration sees that this will be led by governors together. I welcome the partnership with the federal government to continue. In many aspects, that has been very good. Director Kelly will tell you, our FEMA folks, I had a great conversation with Secretary of Defense Esper the other day. I will be on with VA Secretary Wilkie in the near future. So we're doing everything we can to make that work. And Minnesotans, you're going into a weekend. It's supposed to be nice tomorrow. Enjoy it. Do the best you can. I know, and you don't need me to tell you this is stressful. You don't need me to tell you that it's incredibly disruptive. But if you could get a little time tomorrow, get that walk with social distancing, play some golf. Shooting ranges are open. Sharpen up your skills. I got a friend from down south. We missed our turkey opener, which for me was probably good news because I didn't get shamed again. But Minnesotans are doing this, and so I've ended every day, and I'm going to do it again. Too many to actually get it, but I'm going to single out these folks who are stepping up. One of the issues we had is our child care providers are doing a great job, but they're running out of cleaning supplies. So Factory Motor Parts in Eagan donated 1,680 gallons of bleach to help Minnesota child care providers. We found some drivers on that. They drove bleach to all of our child care providers around the state to make sure that they were being cared for. That's that's an incredible gesture of goodwill. It's also one of, again, our best defenses against this. So we'll continue on. We'll try and get you as much information as possible. The team here will try and lead into this issue because it'll probably be developing over the weekend with the Worthington situation. We'll try and get you as many updates as we can as that information becomes available. Thank you all. Thanks, folks.